Assalamu alaikum dear students. Welcome to Dr. Roomi lectures. Today we are going to study a very important topic from sensitive physiology. Have you ever wondered when you are having pain, it's difficult to sleep, and also when you are wearing a ring or a watch, as long as you are wearing it, usually we are not aware of it. But when we put it on or we remove it, then we notice it. What is the physiological basis behind these two phenomena? You will find answer to these questions when we will study the topic of sensory receptor adaptation. In our previous lecture on sensory receptors, we studied the classification of receptors. We have classified receptors on the basis of various criteria, and one of the criteria was on the basis of their adaptation, on which we can classify receptors into rapidly adapting and slowly adapting categories. I have seen a university question in which the students were asked difference between the features of tonic and phasic receptors. You will find answer to all these questions in today's session. So before I explain the definition and types of sensory receptors on the basis of their adaptation, let's quickly revise receptor potential and its relationship with action potential. We will take the example of Pacinian corpuscle is a receptor for fast vibration. It is made by ending of sensory nerve fiber. The ending is not myelinated. This is covered by multiple rings of connective tissue, and these rings, they are having multiple layers just like peels of onion. So let's suppose we have removed all the peels here and the outermost layer is shown here. This nerve fiber, it is having myelination just before it leaves the connective tissue capsule. We have studied previously that when we give a stimulus to this receptor and the stimulus is stretch or pressure on this receptor, so when we put a pressure on this receptor, what happens? There is indentation, and that causes opening of sodium channels. No, normally at rest there is positivity outside and there is negativity inside of the cell. This is resting membrane potential. So when we give a stimulus to this Pacinian corpuscle, what happens? There is opening of sodium channels and there is flow of sodium inside of the cell. This positivity which takes sodium inside of the cell, this is a journey towards the threshold, and this is a localized potential. We call it receptor potential. This receptor potential, its currents flow to the nearby node of Ranvier, and there is opening of sodium channels there. Here the sodium channels, they are opened by mechanical stimulus, which is pressure, and here the sodium channels, they are opened by the electrical stimulus. So it means this is a voltage gated sodium channel. So sodium moves from outside of the cell to the inside, so inside becomes positive and outside becomes negative. In this way, these currents, they jump from one node of Ranvier to the other node of Ranvier, and the action potential travels along this nerve fiber, and our brain is apprised of the deep pressure or vibration sensation. So what we have studied here, that whenever stimulus is applied, that stimulus causes opening of some channels, and then there is movement towards positivity. So it means inside becomes positive or less negative. This is because of opening of sodium channel. Because we apply this mechanical stimulus, so mechanically sensitive sodium channels open here. So when this threshold is achieved by the receptor potential, there is opening of voltage gated sodium channels, and these voltage gated sodium channels, they open here, and then the action potential travels along the nerve fiber very rapidly. It's saltatic conduction because the action potential jumps from one node of Ranvier to the next node of Ranvier. Now let's talk about the definition of receptor adaptation. When we apply a continuous stimulus to a receptor, and this receptor is Pacinian corpuscle. So when we apply a stimulus, so this on means the stimulus is being applied. This stimulus, when applied to this Pacinian corpuscle, it opens sodium channels. So sodium moves inward. These are mechanically sensitive sodium channels. There is movement of the resting membrane potential from minus 90 towards threshold. So once the threshold is achieved, then there is action potential. And this action potential is because of opening of voltage gated sodium channel. More is the amplitude of receptor potential, more will be the frequency of action potentials. So when we give a stimulus, and this stimulus is a constant stimulus, initially there is change in receptor potential, there is increase in frequency of the action potentials which travel along the nerve fiber. But with the constant stimulus, the receptor potential declines rapidly. So with constant stimulus, the receptor potential comes to rest, and then there is a silence here. There is no more action potential here. There are no spikes here. So this kind of receptors, which initially when a stimulus is given, they show a very rapid change in their receptor potential towards positivity, and there is increase in number of spike potentials. But with a sustained stimulus, there is a decline, rapid decline in the receptor potential, and there is a silence here. There is no more action potential. So this kind of receptors, they are called as rapidly adapting receptors. The other kind of receptors, when we give them a stimulus, so this is stimulus given here, this is a stimulus, on means the stimulus is given here, there is increase in receptor potential and there is increase in the frequency of action potentials. But with the sustained stimulus, what happens? The receptor potential slightly decreases. So it means still there is enough number of action potentials which are being fired along the nerve fibers, and with the sustained stimulus, the receptor potential will gradually decrease. It may decrease gradually and come down below the threshold value, and then the action potentials may decrease, or the action potentials may become very less, or there is no more action potential. So it means these receptors, they also adapt, but they adapt slowly. So these kind of receptors, they are called as slowly adapting receptors. The typical example of slowly adapting receptors is Merkel's disc. Merkel's disc also detect pressure from the skin, and here Pacinian corpuscles, which are an example of rapidly adapting receptors, they also detect pressure and vibration. The other name for slowly adapting receptor is tonic receptors. These rapidly adapting receptors, they are also called as phasic receptors, or we can call them rate receptors, or they are also called as movement receptors. So they have got four names: rapidly adapting receptors, phasic receptors, rate receptors, or movement receptors. So what you can see here, when we remove the stimulus here, when we remove the stimulus here, then there is sudden decrease in the receptor potential, and there is no more firing of the action potential. In case of rapidly adapting receptors, when we remove the stimulus, there is again appearance of receptor potential, and some action potential, they again start firing. It means they also show an off response. So rapidly adapting receptors show an on response by changing receptor potential, and the action potentials travel along the nerve fiber. With this sustained stimulus, there is no more receptor potential and there is no firing along the nerve fibers. And with the off stimulus or no stimulus, there is once again appearance of the receptor potential, and the action potential is once again start firing along the nerve fiber. It means rapidly adapting receptors, they inform our brain about the change in the stimulus, whether the stimulus is switched on or switched off. For example, some tactile receptors or mechanoreceptors from our skin which detect change in pressure, they belong to rapidly adapting receptor. And this is why when we put on our clothes, or when we wear our watch, or we are wearing a ring, we know it. But as long as we are wearing these things, we usually don't notice them unless we remove them. So it means the wearing of watch, ring, and clothes is noticed by our body because there is change in pressure. And as long as we are wearing them, we become accustomed to it because of rapid adaptation of these receptors. And when we remove them, once again we notice it. So because once again there is appearance of receptor potential and action potential, they start firing along the nerve fibers. The rapidly adapting receptors, they have got a very important function of prediction. They can inform our brain about what is going to happen in the next few seconds. For example, the semicircular canals. Semicircular canals, which are present in the internal ear, they are important to detect change in the angular acceleration. For example, if we are running in a curve, our head is rotating and these semicircular canals are stimulating. The predictive function of these semicircular canals is to estimate where our body will be within the next 2-3 seconds. And in this way, these semicircular canals, because of their predictive role, they will inform our brain about the change which is occurring in our body when we are making a turn, when we are running in a curve, and our brain will do the adjustments which are required, and it will prevent us from falling. So this is a feed forward mechanism or predictive role of semicircular canals. The other examples of rapidly adapting receptors are Meissner's corpuscles. As you know very well that Meissner's corpuscles, they are important to detect the flutter and low frequency vibrations from the skin. The Pacinian corpuscles, they detect rapid vibrations and deep pressure. Some other rapidly adapting receptors are the receptors for sense of smell or olfaction. You see, when you enter in a room where there is a good or bad smell, initially you notice it, and then within a few seconds there is rapid decline in the intensity of sense of smell. This is because of rapid adaptation of the sense of smell. Some other examples of the slowly adapting receptors are muscle spindles, Golgi tendon organs, and also some joint capsule receptors. These are all very important proprioceptors. You know, proprioceptors, they're important to apprise our brain about the change in position and movement of our body. So, for example, if we are sitting on a chair, these proprioceptors, muscle spindles, they will inform our brain about the change in length of a muscle. Golgi tendon organs, they will inform our brain about the load on the tendon of a muscle, the load or the tension. And similarly, joint capsule receptors, they will inform our brain about the rotation of our joint, about the stretch on our joint. And whenever our brain is aware of it, and whenever there's some need, the appropriate adjustments can be made. Baroreceptors, which are present in the larger arteries, in the arch of aorta and the carotid sinus, they are very important mechanoreceptors. They are also slowly adapting receptors. Ruffini's endings, which are important to detect the stretch of a joint or rotation of joint, they also adapt slowly. So most of them you can see here that they are mechanoreceptors and they're slowly adapting receptors. There are some non-mechanoreceptors which are slowly adapting. For example, pain receptors or nociceptors. Let's suppose if a person is having a kidney stone or some fracture of leg. If there is some severe pain occurring in our body, the person will not be able to sleep. It's because as long as that pain stimulus is there, there is enough receptor potential which is above the threshold, and the number of action potentials, they will keep on firing along the nerve fibers, informing the brain about the continuous stimulus. As long as that constant pain stimulus is there, so there will be enough receptor potential which will be above the threshold value, and you can see here there will be action potentials which will remain there for hours and days, and it will inform our brain about the damage which is occurring in the tissue. This is a very important protective role of the pain stimulus. So pain is protective in nature, which means that as long as pain stimulus is there, the receptors will not adapt, and we have to seek for some clinical remedy so that noxious stimulus is removed, and the tissue repair occurs. Another example of slowly adapting receptors is chemoreceptors, which are located in the aortic and carotid bodies. They detect change in oxygen level, carbon dioxide level, and hydrogen level. Another slowly adapting mechanoreceptor is the macula, which are sensory receptors for detecting linear acceleration. These are present in the utricle and saccule of our vestibular apparatus located in the internal ear. They are slowly adapting receptors. So they continuously inform our brain about our gravity, about our linear movement. Semicircular canals, they work when we take a turn, and they are rapidly activated and they switch off rapidly when there is a continuous stimulus. So semicircular canals are rapidly adapting receptors, but the macula, they are slowly adapting receptors in the utricle and saccule of the vestibular apparatus. Now let's talk about the mechanism of adaptation. Different receptors in our body adapt differently. For example, the rods and cones within the retina of our eyes, they adapt by changing the levels of photosensitive pigments like rhodopsin in them. During night or dark adaptation, rods increase their concentration of rhodopsin, and during daylight, the cones and rods as well, they decrease their photopigments. The receptor adaptation has been extensively studied using Pacinian corpuscles. So I will explain you how receptor adaptation takes place in Pacinian corpuscle. It is by two mechanisms. First is by change in the structure of the receptor. For example, when we apply a pressure stimulus, there is some indentation on the receptor. That indentation presses on the nerve fiber, and there is opening of mechanically sensitive sodium channels. When this pressure is sustained, there is a redistribution of the fluid throughout this receptor. It's viscoelastic receptor. When there is sustained pressure, there is distribution of fluid, and these mechanically sensitive sodium channels, they are no more stimulated. It means the change in structure of this receptor with a sustained pressure or sustained stimulus will not be able to stimulate the mechanically sensitive sodium channel. This is one of the mechanisms. Another mechanism is relatively slow, and we call it accommodation. In this accommodation mechanism, there is inactivation of sodium receptors. Many receptors in our body, they adapt by this mechanism of accommodation, that when we give them a sustained stimulus, the receptors or channels, they become inactivated. So sodium channels here, they become inactivated with a sustained stimulus, and we call it accommodation. Just to summarize, there are two mechanisms by which Pacinian corpuscle adapts. First is by change in the structure of this receptor or redistribution of the fluid, so that the mechanically sensitive sodium channels, they are no longer stimulated with the sustained stimulus. And second is, even if there is a sustained pressure here on the nerve ending, and it is stimulating the nerve ending continuously, what happens even with this sustained pressure and this sustained indentation, there is inactivation of the sodium channels, which we call as accommodation. So these two mechanisms, they are responsible for adaptation of Pacinian corpuscle. But keep in mind, just like I have explained for rods and cones, different receptors, as they are transduced differently, similarly they have different mechanisms of adaptation. But I have explained you the mechanism of adaptation using the Pacinian corpuscles because they are more extensively studied. Now I would like to give you a very interesting mnemonic to memorize the examples of rapidly adapting receptors is Miss Pacific Crown. I have been working at Fiji National University in Fiji Islands. Fiji is located in the Pacific Ocean, so I have made this mnemonic of Miss Pacific Crown. Miss Pacific, let's suppose, is a lady who's having a fast personality. She wins the contest and wears a crown. So from this mnemonic, you can memorize Miss for Meissner's corpuscles, Pacific for Pacinian corpuscle, and crown on the head. We have hair on the head. So another example of rapidly adapting receptor is the hair follicle receptor. You see, hair follicle receptors, they are present at the base of the hair follicles, and they inform our brain about change in the movement or change in the direction when these hair are touched, or when some insect is crawling along our skin. So these three important examples. One is Miss for Meissner corpuscle, um, Pacific for Pacinian corpuscle here, and crown on the head is for hair follicle receptors. The rest of examples, they are for slowly adapting receptors. Now, the very important exam question, differentiate between the features of rapidly adapting and slowly adapting receptors. So here I would like to summarize the differences between rapidly adapting and the slowly adapting receptors. You see, rapidly adapting receptors, when we give them a sustained stimulus, initially there is increase in receptor potential, but with the sustained stimulus, there is rapid decrease in the receptor potential and there is no longer any action potential. So only with the switch on and switch off of the stimulus, there is appearance of the receptor potential and also the spike potentials here. But with the sustained stimulus, there is no receptor potential, no action potential. It means the rapidly adapting receptors, they detect change in the stimulus strength and also the switch on and switch off of the stimuli. So when the and this is why they detect the vibrations, they detect the rate, they detect the movement. These are called phasic receptors. The slowly adapting receptors, when we give them the stimulus initially, there is appearance of the receptor potential, but with the sustained stimulus, the receptor potential remains. The receptor potential may remain there for minutes and hours and even some for some days. For example, in baroreceptors, the adaptation may take 1 to 2 days to occur. And as long as the receptor potential is above the threshold value, the although the number of spikes or action potentials may decrease gradually, may finish at all, but they take more time. So that's why the slowly adapting receptors, sometimes they're also called as non-adapting receptors if they take several days to adapt. The important examples of rapidly adapting receptors are Meissner's corpuscle, Pacinian corpuscles, the hair follicle receptors, the receptors for sense of smell, and semicircular canals in our vestibular apparatus. And here the examples are some mechanoreceptors and non-mechanoreceptors. Among the mechanoreceptors, Merkel's disc, the muscle spindles, Golgi tendon organ, joint capsule receptors, baroreceptors, Ruffini's endings, and also the macula, which is located in the vestibular apparatus, the utricle and saccule of our internal ear. They're all mechanoreceptors. Some non-mechanoreceptors which are slowly adapting are the pain receptors and chemoreceptors, which are present in the carotid and aortic bodies. The slowly adapting receptors are also called as tonic receptors, and the rapidly adapting receptors are also called as phasic, rate, or movement receptors. So I hope you have understood that the receptors in these two classes, they are different from each other on the basis of their receptor potential and the rapidity at which the receptor action potential dwells and for how long the action potential remains there, and how rapidly the action potential decreases. It's a very important exam question, so you may be asked as a short answer question in your examination from this topic, or maybe an MCQ or viva question from the examiners. So thank you so much for watching this video. See you next time with another video.